Siksika is the second largest reserve in Canada. Population is approximately 7,800 people. Siksika Health provides services to approximately 3,700 members.
So yeah, it's a big learning curve when people come here, but everybody's so welcoming. The clients are so welcoming. The elders always will welcome you into their house and tell you stories and teach you the culture. And it's a pretty special place to work.
We're very busy in home care. I think we have, last count was 237 clients for all sorts of different services.
Working in home care, I provide daily wound care, medication administration, referrals to doctors, specialists, counseling, just being there for our clients.
I do a lot of case management, there's only Cheryl and I that are the RNs right now, so a lot of case management, a lot of time on the phone, a lot of follow-ups, making sure people are going to their follow-up appointments post-hospital discharge, making sure they're set up for hospital discharge, a lot of case conferences.
And so my services are predominantly focused on independence and safety in the home. I will get a referral either through home care or through the physician's office, or even through community partners. So I'll get referrals directly through hospitals or social workers or transition services. And essentially what's happened is that the client has encountered some type of medical condition, whether or not they've had an issue with their heart, or they've had a stroke, or they've encountered a broken bone of some sort, or, a chronic disease that they no longer can live or be safe in their home independently.
The biggest change since I started has been the acuity of the patients. The patients are coming out with out of the hospitals with higher medical needs. We've needed a lot higher level of nursing.
The community members will call and say, I have a wound, come see me, and it's something that needs a hospital, but they don't want to go. So we're doing a lot of immediate first assessments on people and gaining trust. There's been a lot for being in Siksika. There's a lot of mistrust with the hospitals and non-nation members.
So some of the challenges in healthcare is just seamless discharges between hospital and community. Often we don't know who's coming home, and so on a Friday afternoon we'll have somebody discharged and presenting to us who needs a list of equipment and a list of services that we aren't able to support just because of the timing. I started in Siksika Home Care in 2006, and so it was paper charts. And so, you would find a chart amongst an array of charts, and yes, it was organized because it's all alphabetical, but the dilemma is if the nurse or a healthcare aide or someone else needs the chart, you don't have access. So you've just got to wait for the chart to be available.
It was tedious, it was long, and I found you rush when I would paper chart it. I would shorthand something, but the doctor read it as something else, mix up in medications, things like that, because it wasn't proficient.
It took up so much of our time during the day. At the end of the day, we had to cut visits short. It's almost like we were stealing time from our clients' care just to make sure that we charted and documented properly on them.
CARE is the electronic medical records that I use every day. It is a charting system, so essentially when I get into the office, it's the first thing that I turn on to look at my referrals. So any of the other staff can refer to me and send me a task so I can see what my day would look like.
I remember having a conversation with Sal before we implemented this. My one condition was that it had to make things easier for nurses because things are too hard for nurses right now. There's too much, and if they could save time, then we were all in, and that's kind of where we started.
It streamlines our nursing care. We're able to take all the information from, let's say, community health, and even our community paramedics utilize CARE as their charting system. And so that way we're getting up-to-date, real-time information about our clients and making sure that we're providing the continuity of care.
They've actually incorporated now, we have a panel of just about all of our clients. So if they are admitted to the hospital or even have an ER visit, they've worked it now that we get notified through care that they are either in hospital or has been seen, and it also pops up when they're being discharged, so we can keep a better eye on them because they don't always call and say, I'm home now and I need support. So that way is another way we can check up and then place a call to them, seeing what they need. So I really, really like care.
And now looking at it as an OT and in my role, equipment is such a big part of my role. So now there's an entire section where I can record the equipment the person needs, the equipment that they've received, the year that they've received it.
Working for home care, you have to keep track of various stats and report back to Health Canada every year. With care, they've kind of made that easier for us. They develop systems within their system that I can pull my numbers for my stats very easily and just submit them for my annual reporting.
Yeah, we've been afforded the extra time with our clients. It's decreased their vulnerability. It's allowed us into their personal space, providing that care for them when they're in a vulnerable situation. You know, we have dressing changes all over the body. We have medication administration all over the body just the same. And so us utilizing that extra time with them helps us build that rapport with them and is affording us their trust.